very good morning to you one more time. And in case you just joined, it is Urban Today, and there are very many ways to get in touch with us using the hashtag Urban Today, or better still, at Kella Mackenzie, at Mitch Didan, and of course the main handle, which is at Urban TV Uganda. Now you can use this on Twitter as well as Instagram and on Facebook as well. We are very much alive in there. We'll actually be having feedback much later on. In today's discussion with our pick of the day, we're looking at circumcision and its importance. A lot of men today will tell you that they are circumcised even when they are not, because they kind of feel today in society you should be circumcised. I mean, why not? But then there are many who say, I don't want to even be in that particular world. So what we're going to do right now is get straight into a small feature of a video, look at the detail of this, and then when we come back in studio, I've got a special guest we shall be talking to get to the bottom of circumcision and its importance. Let's go.
Male circumcision is the surgical removal of the foreskin of the male's penis. Medical male, no, it is almost the same. Just when we talk of safe, it is done by surgical or trained or maybe certified personnel. These are medical people who are trained specifically to do the circumcision. Of course, when we circumcise you, we don't expect you to have sex there and then. It takes time, like about 6 weeks, of course with a condom, and then you have to play live sex after 6 months. Then another thing, when you're circumcised, we don't expect you to apply anything. You leave the wound dry and take out the medication we've given you. In case of anything that you feel you don't understand, you just call on us or even visit our center. The people, of course, this circumcision is from 10 years and above. The people entitled to do circumcision, you have to be a male first. Then you also have to qualify through our assessment, the medical assessment. One, if you have any abnormality, you do not qualify. If you're sickler or you have sickle cells, you also don't qualify. If you have any STI, you don't qualify until it is treated, which treatment we also offer. Of course, with the research and proof, we've seen that it's working with so many testimonies from people and what. But people, most people do mistake us. When we say 60% reduction, some of these people think that they are immune, forgetting the other 40%. So even though you're circumcised, you have to take on other precautions like the ABC strategy. However much someone is circumcised, even if he has that 60% reduction, this person should take note that he also needs to take other precautionary measures so that he stays safe. So even if you're circumcised, there is also the other 40% of you getting the HIV. So please guys there, if you know you're circumcised, you need to still stay safe. So please, even though you're not circumcised, you need to test this partner. If not, you need to test this partner. And if you're not sure of her, please use a condom or even abstain. There are so many challenges, most especially the myths. Like people would ask you a question. We heard that after you circumcise us, you're going to take us to sell our prepuce. After circumcision, you're reducing on our manhood, that medicine that you use. Or what, then some even, most especially some religious leaders and some cultures, like religious leaders would say, no, you want to convert our boys into Muslims. And even cultural people would say that, no, we want to take our people into the other Bagisu culture or the Bakonjo culture. But this circumcision, I would stress it, it is intended for only and only medical reasons. It is not culture or religion. It takes about 1 week to 14 days. That's 7 to 14 days if you do all what we tell you to do. But this healing is when you no longer see the wound. But there is also now the people who are married or who are sexually active who would like to resume sex. You resume sex after 6 weeks. But with a condom, because this wound is still soft, up to 6 months. So you have live sex after 6 months.
Well, there you go. Very interesting looking at that and the way it comes out. In very many ways you can put it. It sounds good, right? It sounds very encouraging for you to go and take it on. You'll be surprised how many people don't believe that. And you'll be surprised how many people are against that. In studio, we decided to actually get someone who can give us more detail on that and maybe see where your balance is. Are you circumcised or not? Is your husband or boyfriend circumcised or not? Or even your son? In studio, we have one Dr. Robert Soka. Good morning. How are you? Very glad to have you here. First of all, introduce yourself to the people. Tell us what you represent and where you're from.
Yeah. Good morning, viewers. I'm Dr. Robert Soka,
Yes.
The voluntary voluntary male medical circumcision coordinator
Okay.
of Makerere University Joint AIDS Program,
Nice.
based at Makerere University Hospital.
Okay.
And we've been doing this circumcision business or like project for close to 6 years now,
Nice.
since 2011.
Great.
Yes.
So do you work mainstream with the university or with the general public?
Yeah, we work with the general public.
With the general
Yes,
public.
it's open to everyone who can
Great.
access.
From your point of view as Dr. Robert, what would you say is the importance of circumcision? From your point of view.
From my point of view,
Yes.
as a medical doctor,
Yes.
I would say circumcision is important in HIV prevention.
Okay.
But it has other benefits like sexually transmitted infection prevention,
Okay.
cancer of the cervix
Okay.
prevention. Like it was found out from research that the men who are not circumcised transmit that virus called the human papilloma virus, which causes cancer of the cervix in women. So that's why I encourage women to have their hubbies or partners circumcised. But also cancer of the penis in men, because the cancer of the penis affects the foreskin.
Yeah.
So having that foreskin removed
Yeah.
reduces the chances of getting cancer of the penis.
Great.
But it's also a treatment option for, like, some people are not able to pull back the foreskin or retract it. So circumcision will be a treatment of
Helpful,
choice.
yeah.
But going back to the medical part, that research has found out that the foreskin or the inner lining of the foreskin is rich in cells that are targets for the virus, which is HIV.
Oh, okay.
So it has a lot of those cells. So once you have intercourse with a person who has HIV, the HIV will be
Yeah.
easily
Spread to you.
easily taken up by those cells which line the inner cells.
Okay.
And it also lacks a protein called keratin, which is found on our normal skin. Realize that maybe if blood pours on your skin, you may not easily get
Yeah.
HIV because it has that protein, keratin,
Yeah, yeah.
which is hard. Yeah, but you realize in the foreskin, this is not there.
Yeah.
So when we remove it, those chances are reduced.
Great.
And then the other thing is it easily gets bruised.
Oh, yeah.
As you can see, it's a bit soft.
Yeah.
So once we expose it to the outside, it becomes harder, and the easiness of getting bruised or even getting wounds
Yeah.
or even STIs are reduced, and eventually it reduces HIV transmission.
Traditionally, for example, like in the eastern side of Uganda,
Yes.
Embalu is a big deal.
Yeah.
If you're not circumcised, you're not regarded a true man or a mature man, or you're not given that credit, street cred, what you would want to call it. Do you think from their position and what we have seen with the Muslims as well for centuries, I think Jesus himself was part of the same situation because he was in that world as well. All these people, time immemorial in the Bible, in everywhere, they've been told about circumcision. But then those days, STDs, or what you would call like HIV, for example, was not in existence. So what do you think was their reasoning back then for actually doing this that could be relative with us today? Because sometimes I've had people who say, I don't want to get circumcised because that's not part of my culture. or it's not part of my tradition, or I'm not part of the religion in there. But someone wants to link the two. Do you think there's any link in there? Is it more about just having traditionally being a part of the system, or it has a lot to do with what you're saying in the sense of hygiene and all that?
Yeah, like going back to the Jesus culture, I think
Yeah.
it was more of like a show of,
Okay.
of like, we are circumcised, so
Yeah.
we are the blessed few.
Okay.
So it was part of the tradition. Yeah, but going back to the local region around, like the Muslims and the Bagishu, I think it was mainly done for either the esteem that you're a man, you're circumcised, and it's good.
Yeah.
For the Muslims, I think it's more of the hygiene bit. They're interested in the hygiene bit.
Yeah.
Yeah, but why us we came in as the medical people to do circumcision is basically for the HIV prevention.
Okay.
Because
so basically your reasoning is nothing to do with religion,
Yes.
nothing to do with culture,
Yes.
has everything to do with the medical part of
the
it.
medical part of it.
Okay.
And that's the thing that if someone might ask that why don't the Muslims get HIV? Like, why do Muslims get HIV if
Yeah.
they're circumcised?
Since they're circumcised.
Yes.
Yeah.
Circumcision doesn't prevent you 100%.
Yeah, it gives
Yes.
you what percentage? does it give?
60%.
Oh, okay.
That's according to the research that was done by the Rakai, that is
Okay.
in Uganda and
Yeah.
Kenya,
Yeah.
and even South Africa.
Okay.
60%, it's not 100%, meaning
You still have to be careful.
you still have to be careful, practice safe sex practices, and also because it doesn't completely take away the STIs.
Yeah.
Like say gonorrhea, you might still get
Yeah.
gonorrhea,
Yeah,
but
yeah.
candida, the ulcer diseases which affect the
Doesn't affect you that much.
those ones might reduce.
Okay.
And once they reduce, then chances are reduced. But if you have gonorrhea, then HIV has where
Of
it
course,
can enter.
it will definitely. Doctor, when we come back, we're going to talk about two things. I've been told that circumcised men give the best sex to the women around. We're going to talk about that. And also I've been told that circumcised men reduce their sensitivity when it comes to sex. There's those complaints that have also come up. We shall talk about that much later on. Interesting topic because it relates with you, whether you like it or not. Now, coming up, you can actually get in touch with us via Twitter. It's at Urban TV Uganda. We are receiving as many tweets as possible. I'll read some of them if possible. And of course, this is literally about your health. When we come back, we have a lot more.